Postpartum depression in teenage mothers, 12 to 19 years old, located in Arkansas. This is Group 14. Sydney Kraft, Emma Eastman, Alma Hernandez, Mallory Karpinko, and Lindsay Weavers. Throughout this presentation, we will be interchanging the words teenage and adolescent mothers. Background information. Arkansas has a higher percentage of mothers experiencing postpartum depression than average in the United States. Untreated depression contributes to suicide, becoming one of the leading causes of maternal mortality within 1 year postpartum. The next two slides are real stories from mothers that are just a couple examples from Baby Center of how postpartum depression may feel. You should ask yourself, have you ever felt these emotions?
Feel guilty that I wasn't happy. Feel guilty that I wasn't.
How am I going to tell my daughter that I didn't want to hold her for the first 2 months of her life? How do you tell, your child that? How am I going to tell my daughter that I didn't want to?
Now, on to key results. Adolescent mothers are more than likely than adult mothers to develop postpartum depression due to their developmental age, fewer coping mechanisms, and lower levels of social support. Since adolescent mothers have lower levels of support, they have no one to turn to if they have feelings of postpartum depression and are less likely to get help. Teen mothers are already more susceptible to major health and social issues that may exacerbate postpartum depression. Teen mothers face social stigma, peer criticisms, high stress, financial insecurity, immaturity, and isolation, which can exacerbate postpartum depression. If left untreated, postpartum depression can interfere with their ability to concentrate and perform well in school, maintain a stable job, and have healthy relationships. This can negatively influence infants, leading to delayed growth, both mentally and physically, attachment difficulties, and increased risk of adverse childhood experiences. Now, onto the health belief model and teenage postpartum depression. The health belief model fits really well for teenage moms who are freshly postpartum because it helps us understand what drives their health decision. It looks at four main ideas. If the person feels at risk, perceive susceptibility. If it is believed that the problem is serious, perceive seriousness. If they believe there are benefits in taking action, perceive benefits. If they believe any barriers are in the way, perceive barriers. Then it focuses on cues to action. These include both internal and external, such as personal emotions, education, peer support, and even health provider encouragement. Now, applying this model variables to the health belief model. How much you feel at risk for something like postpartum depression, that's perceived susceptibility, and how serious you think it is, perceived seriousness. Then it considers whether they believe taking action will actually help and what barriers might hold them back, like fear or lack of support. Cues to action are also important, things like emotions or education or encouragement from friends or nurses that can motivate them to seek help. Overall, this model really helps us understand what motivates or prevents teenage mothers from seeking help postpartum. Now on to our goal. It is to increase awareness, screening, and management of postpartum depression among teenage mothers ages 12 to 19 in Arkansas by empowering them with knowledge, early detection tools, and supportive resources. This goal addresses these critical needs: improve mental health outcomes, reducing the impact of untreated postpartum depression on mothers and infants, enhancing health literacy around postpartum depression, nutrition, and self-care. Desired health outcomes. By implementing education, consistent screening, and accessible resources, the long-term result will be improved maternal mental health, stronger mother-infant bonding, and lower rates of adverse childhood experiences. Now on to our 3 SMART goals. SMART goals are specific, measurable, attainable, relevant, and time-bound. Over the first 12 months, postpartum provides education on nutritional needs, sleep deprivation, and lactation demands to 100% of postpartum moms 12 to 19 years old in Arkansas, reevaluating nutritional standards annually. By October 2026, have 90% of moms 12 to 19 years old in Arkansas to be compliant with postpartum depression screenings at 2 weeks, 6 weeks, 3 months, and 6 months postpartum appointments. Distribute educational material and helpful resources on signs and symptoms of postpartum depression to 100% of delivering moms aged 12 to 19 years while at the hospital or clinic in Arkansas to use during postpartum by December 2026. Now on to our 3 feasible strategies. An AI resource for young moms to ask questions about nutritional, sleep, and lactation demands and needs using verified and accredited information. then new postpartum depression screenings at pediatric clinic visits, and an access to hand out pamphlets to share the most prevalent information about postpartum depression as well as signs and symptoms to look out for. Now, ask our AI program any questions about our goals, strategies, belief model, or postpartum information such as signs and symptoms. Scan the QR code down below. And don't forget, it is important to stay on top of both scheduling and attending your postpartum depression screenings to stay on top of a diagnosis. This helps both you and your baby as you take proactive steps to stop postpartum depression's impact on your life. And check out our info pamphlet. Take a look at the information pamphlet to learn about the common signs and symptoms and find out what steps to take if you think they apply to you. And lastly, our evaluation plan. There's an educational survey and check-in survey down below. Make sure to scan the QR code. Thank you for listening about our presentation on teenage postpartum depression.